India is a vast country with enormous geographic and economic disparity. This makes it difficult for some to access even basic welfare services like health on time. Especially in the tribal areas that are typically sparsely populated, distances are huge as compared to the population. Even if we consider efficient service by the government ambulance system, which of course varies from place to place, there still remains a huge service gap. The issue is particularly aggravated and critical in remote tribal areas where many of the villages are far from motorable roads, and in case of a health emergency, people have to be brought to a motorable road on makeshift palanquins. The number of government ambulances is less than the actual need. For example, in an administrative block of more than 1,000 square kilometers, with a population of between 1 and 2 lakh, there are generally about 2 to 3 ambulances only. They are often already on a serving trip when another emergency call is received, which leads to huge delays in servicing that call. These matters are not clearly visible in urban areas because of private ambulances, possibility of hiring four-wheelers, or presence of any other four-wheelers owned within the communities. The Parivaar ambulances with their quick response times serve a very urgent need. Now the problems of transporting sick patients and women in labor to hospitals and taking accident victims to clinics can be alleviated.
In the last 3-4 years of our work in Madhya Pradesh, we had identified this need that in these areas, let's say a tribal block, which is a subdivision of a district, there is an area of around 1500 square kilometers, a population of around 1.5 to 2 lakhs, but there are very few government ambulances, and since these locations are quite spread out, so it takes a lot of time for one ambulance to get one patient to the home, from the home to the hospital. So identifying that need and seeing that the supply was far lacking in terms of the demand, we deployed ambulances.
Keeping in view the needs of the poor tribal population, Parivaar has started an absolutely free of cost 24/7 ambulance service in the tribal areas in Madhya Pradesh. Starting from June 2021, Parivaar has deployed 129 ambulances in 25 districts with a well-planned structure. A centralized call center number has been set up for the ambulance service for every district. Parivaar Seva Vratis visit every village and promote this phone number with the cooperation of the block and village-level health workers, Anganwadi workers and Panchayat members. Villagers are informed about the free round-the-clock ambulance facility. For the purpose of publicity, pamphlets are distributed in every village and public places. For villages that face mobile network connectivity issues, an Asha worker or the village sarpanch or head is designated to act as a nodal point for the ambulance service. On receiving a call, the call center staff immediately notes down the relevant details including name, address and illness. Thereafter, he passes on the information to the nearest ambulance. As a result, the ambulance reaches the patient at the earliest. In the hospital, the ambulance staff stays by the side of the patient until the admission process gets over. In case the patient is referred elsewhere, the ambulance takes him or her there as well.
हमारी एम्बुलेंस पर 4 स्टाफ हम लोग रखते हैं। चूँकि ये 24 घंटे चलती है तो दिन के समय के लिए 2 स्टाफ और रात के समय के लिए 2 स्टाफ रखते हैं, जिसमें एक ड्राइवर और एक अटेंडेंट होता है। ये जो मेडिकल अटेंडेंट हमारे एम्बुलेंस पर रहते हैं, इन लोगों को स्पेसिफिकली समय समय पर ब्लॉक मेडिकल ऑफिसर द्वारा या CHC स्टाफ द्वारा ट्रेन किया जाता है कि ये एम्बुलेंस में किस तरह से ऑक्सीजन सिलेंडर का यूज़ कर सकते हैं, मरीज की कैसी स्थिति देखकर वो निर्णय लें कि उन्हें किस अस्पताल में, किस तरह के लेवल के अस्पताल में पहुंचाना है, ये ट्रेनिंग उन्हें दी जाती है। तो इस तरह से एक प्री सेट माइंड के साथ हमारे एम्बुलेंस स्टाफ काम करता है।
एम्बुलेंस रीचेज द प्लेस ऑफ द पेशेंट विद इन हाफ एन आवर and then takes them to the nearest government hospital, which is basically a community health center at the block level. And if the case is referred, if the case is severe and it is referred to a district hospital, then the ambulance takes it to the district hospital. From district hospital, in certain cases, the case is referred to the nearest city, such as Indore, Bhopal, Nagpur, Gwalior. So our ambulance takes them there also.
मेरा कुछ दिन पहले एक्सीडेंट हो गया था, गिर गया।
A few days back, Sadhu Ram was injured and became unconscious. His son called the Parivaar ambulance. Within 20 minutes, the Parivaar ambulance arrived. He was taken to the Tamia local hospital. There, observing his condition, they referred him to the Chhindwara district hospital. The same ambulance took him to the Chhindwara hospital. From there also, he was referred to the Nagpur hospital, which was in another state. The ambulance took him to the Nagpur hospital, where the treatment given helped him overcome his injuries. Without the help of the ambulance, he would not have survived.
वो गाड़ी ना होती एम्बुलेंस तो मेरी जान बचना मुश्किल था सर।
अलीराजपुर से आ रहा था कॉलेज से, तो सामने बोलेरो।
Lalit was returning from Alirajpur when an oncoming bolero dashed him. Soon, he contacted a Parivaar ambulance, and within 15 minutes, the ambulance arrived on the spot. He was taken to the Alirajpur district hospital immediately. Since his condition was serious, he was referred to Chota Udaipur in Gujarat. The ambulance and staff took him there, got him admitted, and he received proper treatment for 8 days. Finally, he was cured and the Parivaar ambulance brought him back home. No money was charged for this service.
वही वापस लेके आई घर तक, कई कुछ निःशुल्क काम करा।
Being a hilly terrain, people encounter different sorts of problems. Lalia Mori's experience is also similar. His house is at the foot of the hill, where the mobile network is mostly absent. One needs to climb the hill even if one wants to make a call to the ambulance.
डिलिवरी केस હતી મારું પરિવારનું ફેમિલીનું તે હવે મને નંબર જડ્યો આ પરિવાર સંસ્થાનો ઇમરજન્સી કેસ હતો.
Lalia Mori's pregnant wife had labor pains. The case appeared critical, so he called the Parivaar ambulance. The ambulance came immediately and took his wife to the hospital for delivery. After the delivery, the ambulance took them back home. The Parivaar ambulance didn't charge even a single rupee.
તો ટાઈમ પર પુગાડ્યો ખરું અને પાછું લાવવા ટાઈમ બી અમને પાછા છોડ્યા, પણ પૈસા અમારી હાથે નહીં લીધા.
Samsher Singh purchased land for a house by paying the required amount. But the owner of the land was not ready to give the possession of the land. Out of frustration, Samsher Singh consumed poison. Fortunately, a villager contacted the Parivaar ambulance. Soon, the ambulance took Samsher Singh to the hospital. The required treatment was given. His life was saved, and it was due to the ambulance and free service of Parivaar that he started a new life again. The service delivered by Parivaar ambulances addresses a highly urgent need necessitating a very quick response time. Cases of delivery and other pregnancy matters, the sick and elderly, snake bites, accidents and other problems are attended to frequently.
खेत में होता रगड़त रंग भालू है, हमने नहीं जाने के भालू।
Bagri Bai was walking in the farm without being aware of what was happening behind her. Soon she heard people shouting to draw her attention to the bear that was behind her. When she started running, the bear attacked and injured her. The people nearby drove the bear away and rang the Parivaar ambulance. She was admitted to the hospital. She has since recovered. The ambulance takes her to the hospital for follow-up regularly.
फिर हमें ले गए बिठा के अस्पताल।
So whatever the need, we try to address it, and these are providing a very fine service, and the community as well as the government has really appreciated our service. In many areas we deployed ambulances in discussion with the local government health officers and the district administration, who also guided us on where there is a critical need.
परिवार संस्था की मदद से हमने कोविड वैक्सीनेशन में मदद करी थी.
Parivaar helped during the COVID vaccination. The people of Parivaar also wanted to do something more for the people here. After close discussion with doctors, it was decided to start an ambulance service to meet the needs of these people of the region. Parivaar arranged for some instruments which were useful for the welfare of the people.
परिवार संस्था की मदद से हमने स्वास्थ्य सेवाओं को और भी बेहतर किया है.
परिवार संस्था जो एनजीओ है मध्य प्रदेश का बहुत अच्छा एक एनजीओ है, उन्होंने हमारे अलीराजपुर में 12 गाड़ियां दी.
Parivaar is a unique NGO. It has donated 12 ambulances in the Alirajpur district. which have been placed in the PHC and CHC. These ambulances continuously satisfy the transport needs of the patients. When we refer the patients to the distant places like Baroda and Indore, then the ambulances become available and the patients are taken to the district places and also brought back home. The important thing is that these services are offered free of cost. In order to extend these services easily and comfortably, more ambulances or similar vehicles are to be made available.
हम चाहेंगे कि और गाड़ियां हमारे जिले को दे, जिससे हमारे यहाँ की जो है स्वास्थ्य सुविधाएं और सुचारू रूप से अच्छी तरह से चल पाएं।
Geographically difficult area है, इसमें ये
The Parivaar ambulance has proved immensely helpful in these kinds of geographically difficult areas. The entire district admires its commitment, devotion, and its way of working. This service has proved to be really beneficial for the general public, especially the poor, as it is helping in reducing death and infant mortality among them.
इसमें मातृ मृत्यु और शिशु मृत्यु कम करने में आवश्यक रूप से ये सिद्ध हो रहे हैं।
Parivaar started a 24-hour free ambulance service in 2021 with absolute selflessness. At present, 129 ambulances are operating in 25 districts. The organization has served more than 1.7 lakh patients. It would be extremely pitiable if people continue to lose their lives on account of not being able to access the hospitals in critical situations. Parivaar's free 24/7 ambulances are the biggest such effort to provide quick and free access to emergency medical care by any non-government organization in India. The contribution of the Parivaar ambulance service to society is being appreciated by all and sundry. Since the organization is working in synchronization with the government, it has led to perceptible changes, rising to everyone's expectations. Truly, the Parivaar ambulance is a boon to the villagers and is saving lives by reaching the unreachable.